Good evening, everyone. My name is Dr. Bankole Adewoyin. In another series of our Health Talk in Enablers Diaspora Grassroots Support Outreach Program, I would like to discuss briefly with us on headaches. It is caused by pain in the head or face and has often been described as a throbbing, constant, dull, or sharp pressure in nature. It's a very common condition by experienced by most people and which may occur as many times as possible during the lifetime. And it has been seen as reasons why for this you may not be able to go to work or school and may even warrant you visiting your healthcare providers. What are the types of headaches that we have? Well, most headaches are not really dangerous, but some have been seen as sign of a dangerous condition. So they are grouped into primary and secondary headaches. In primary headaches, is seen as the overactivity of the pain-sensitive features of the brain and not caused by any medical condition per se. We have types under this primary. We have the tension headache, which is the most commonest and is a generalized form. Migraine headache, which can be hereditary, it affects certain parts of the body, of the head. Then we talk about the cluster headache and new daily persistent headache. Some triggering factors has been associated with this headache, which can be seen in alcohol intake, especially red wine, has been seen as a culprit in this condition. Then processed red meat, because it contains nitrate, it has been seen to cause headache in an individual. Then poor sleep, poor posture, vigorous exercise, coughing, sneezing, and in some individuals, for all you care, excessive laughing or crying has been seen to be attributed to their headache. Although they are not dangerous, but it can give a painful experience. In secondary headache, these are caused by underlying medical condition, and some of them are not necessarily dangerous because it gets resolved immediately. We remove what is causing it. Example of this is seen in a dehydration headache as a sort of an individual not taking enough water, and immediately you take enough water, you are home and dry. Then sinus headache, which there is congestion of the sinuses in the nasal part of the head. Immediately an individual is able to decongest the sinuses with hot packs, antibiotics usage, and analgesic, it will be resolved and you'll be good enough. Another type is the medication overuse of an individual. It causes headache and it should be well attended to. Some of these headaches too are particularly life-threatening and should be treated as such. Example is a spinal headache. In spinal headache is as a result of the leakages of the spinal fluid because of the membrane covering the spinal cord has been breached here during spinal tap procedure. So individual should be treated as soon as possible because if left untreated, it can cause subdural hematoma and seizures. Another type of dangerous headache is a thunderclap. We call it thunderclap because you experience like a sudden clap of a thunder, which will be experienced within 1 to 5 minutes. It is important that urgent medical care should be taken so as to know the underlying factor causing it, because a dangerous episode has been seen and it occurs when there is head injury if there is bleeding to the brain, if there is rise in the blood pressure of an individual, one can experience a thunderclap form of headache. The headache is seen in nearly all, both male, female, children, or adults. So, 90% of people will experience headache in their lifetime, and 40% will be of the tension type, while 10% will be the migraine form of headache. How does headache occur? It's as a result of the signals interacting between the brain, blood vessels, and nerves. It's these nerves that will send pain signals into the brain and will cause headache. There are some symptoms that warrant urgent attention that one should look out for in headache. If somebody is having headache that is new, sudden, and severe, if there is agitated fever, shortness of breath, neck stiffness, rashes, headache after head injury, after an accident, or an individual having a new type of headache at age 55, one must be worried enough to take urgent care to treat the patient. And some people, there may be weakness, dizziness, loss of balance, paralysis. Singing sensation can be felt. Some may not even be able to talk very well. We should try as much as possible to diagnose after we have taken a thorough history, physical examination, neurological examination. All this we put together to know if there is need for an additional investigation, especially in the form of CT scan and MRI, because this one will be able to pinpoint where there is an issue within the central nervous system of an individual. It's going to show us a cross-sectional image of the brain that has an abnormal features. How do we treat? You treat based on triggers. Stress management, allow an individual to have adequate relaxation. Biofeedback mechanism is also in place for treatment by attaching sensors to the individual, because to be able to measure the involuntary responses of the individual to headache. Medications are often used in headache, especially mild headache. The over-the-counter a pain reliever can be used to treat them. Allow the individual to have stretch exercise, massage the head, neck, and the scalp, and at the same time you can allow an individual to have rest in the dark and quiet environment, and thereafter one can exercise by walking. Is a light walking. Then in migraine headache, triptans has been seen to be of very good assistance. You give triptans to patients having migraine headache, and we also treat underlying conditions like high blood pressure, depression, seizures. We should treat it in an individual. The headaches will not stop at this. There will be further series in this episode, in this discussion, whereby we're able to talk about headaches in pregnancy, headaches among children, and further explanation in headaches. Stay tuned. Thank you and God bless.